Many of us lead very active lifestyles. And are we doing all that we can to stay healthy? From eating right to getting enough sleep to staying hydrated to limiting screen time, there's a lot of things that we can do to stay healthy. And on today's show, we're going to go through some of those things with you. We're going to also introduce you to lifestyle medicine. And as always, we're going to answer your questions on this episode of Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, and welcome to Ask the Doc, No Appointment Needed, the show where we answer your healthcare related questions by medical experts. My name is Dr. Kamaljit Kaur, and I am a board certified primary care physician here in beautiful South Florida. It's great to have you join us, so let's get right to it. Our first question comes to us from Janae, and she emailed us this question. Let's see what Janae is asking. What exactly is lifestyle medicine? Firstly, thank you for your email, Janae, and thank you for asking such an important question. Now, lifestyle medicine is a newer approach to holistic medicine that focuses on preventing, treating, and in some cases, even reversing disease and chronic conditions. And it focuses on doing this by using 6 pillars or 6 theories. So, what are these 6 pillars? Let's go through them quickly. One of them, the first one, is a whole foods, plant-based or predominantly plant-based diet to get optimal nutrition. Number 2 is getting regular exercise and physical activity. Now, this looks different for everybody, but moving your body regularly really does optimize your health. Restorative sleep is the third and probably one of the most important ones. So, not just getting sleep, but restorative, restful sleep. The next one is stress management and stress reduction, which I know is difficult to think about, but it's so important to do. The next one is minimizing your intake of risky substances, so caffeine or excess caffeine, alcohol, those types of things. The other thing that is really important when it comes to lifestyle medicine and using it to stay healthy is social connections. Now, as a board certified lifestyle medicine physician, I am passionate about guiding my patients in using these 6 pillars to optimize their health, live happy, live long, and live healthy. Let's get to the next question. This one comes to us from Alicia, and she sent us this through an email. Alicia asks, how can I prevent sinus infections and migraines? I sometimes get both at the same time. Oh, I'm so sorry to hear that, Alicia. I can imagine how frustrating that is to have a sinus infection and that's painful enough. And then on top of it, to get a migraine headache. Now, whenever a patient of mine is getting recurrent infections, I want to know why. Even if it's a ear infection, a sore throat, or a skin infection, no matter what it is, and especially sinus infections, we want to get to the root cause of why you're getting these infections repeatedly and treat that. Now, there could be a lot of different root causes for it, as something as simple as seasonal allergies to something as drastic as maybe an anatomical abnormality in your sinus airways that's preventing normal clearing and normal functioning of the sinuses. Now, this is something that when you have sinus infections that are coming on recurrently, of course, you want to see your primary care physician about it, but you may also be sent to an ear, nose, and throat specialist to really get into the nitty gritty, examine your sinus airways, and see what's going on in there. The same concept applies to migraine headaches. If you're somebody who's getting migraine headaches repeatedly, same thing. We want to know why. What's causing these? Is it dehydration? Is it stress? Is it lack of sleep? Or is it those sinus infections that are triggering the migraines, which is also a very large possibility. Now, I certainly suggest that you consult with your primary care physician again to get to the root cause of this so they can get you a targeted treatment plan and get you feeling better quickly and healthily. Let's get to our next question. This one comes to us from Laura, and Laura has sent us an email asking, I've been having bad pain in my jaw, and I believe it's a TMJ flare-up. How do you think it happened, and what can I do to help? My bite feels off, and it's hard to chew and fully open my mouth. Hi, Laura. Thank you for sending in this question. And I'm so sorry to hear that you're having this. Just like with sinus infections and migraine headaches, pain is just unbearable and just annoying sometimes. It can be the absolute worst. Now, if you're referring to TMJ, I assume that you are referring to your temporomandibular joint, which is right here in your jaw. Now, for a variety of reasons, this joint can flare up or become inflamed. Reasons are varied. They can be something that's in your teeth, so a dental concern. If you grind your teeth at night when you sleep, that can certainly cause a flare up. If you have muscles that are really tight in the neck or the jaw, that can cause a TMJ flare up as well. A local infection in your mouth can cause that to happen. And really, a lot of people don't know this, but even genetics play a role in TMJ disorders as well. So again, you want to get to the root cause of why this is happening, because it's important to chew, you need to get your nutrition, and it's important to be able to function, or your jaw to be able to function appropriately for all the things that it does, right? Now, I'm not sure which reason pertains to your TMJ flare up, but I do suggest that you see your dentist for a full evaluation. So when they figure out what is going on, then they can treat it appropriately and they can have you feeling better and back to your normal self. All right, we still have time to answer all your questions, and it's so easy to send them to us. And here's how you can do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So let's get back to those questions. The next one comes to us from Deborah, and Deborah sends us this question about, a very important topic. Deborah asks, I was wondering, what kind of tests determine if you have Parkinson's or not? What kind of tests do they give you? Just curious, is it blood work? I mean, I don't know because I feel like I have some symptoms. And when I go to my primary doctor, should I ask them about what kind of tests I should have? I'm new to this and I appreciate your assistance. This is a great question, Deborah, because Parkinson's is something that, even though it's not quite common, it can be quite impactful to your health. And if you suspect that you have this, it's important to get looked at and evaluated by your doctor as soon as possible. Now, Parkinson's, there's actually different types of Parkinson's that a lot of people don't know about, but the most common is the traditional or commonly known Parkinson's disease. And Parkinson's disease, for those of you who don't know, it is a neurodegenerative disorder that usually starts in adulthood and unfortunately is progressive. We have not found a cure for this disease yet, but we do have medications that can slow its progression. So if you have any symptoms, and I'll go through them in just a second, that you think are representative of Parkinson's, you want to get looked at right away, because the sooner you get diagnosed, the sooner we can start those medications and improve the quality of life that you would have had otherwise. Now, while there's no particular test or imaging, MRI, anything that can pinpoint and say, yes, you have this positive, so that means this is Parkinson's. There are times when your doctor is going to want to do blood tests and imaging tests to rule out other things that can be causing your symptoms. So let's get into those symptoms, because there's a couple of them that lead us to suspect the diagnosis of Parkinson's. One of them is bradykinesia. Now, bradykinesia is a slowness of movement. So whereas you would be, moving normally, you start to notice that you're very, very slow and you're not able to go as quickly as you could before. Then you have what's called a resting tremor. This is also seen in a lot of Parkinson's patients, and that's basically you start to notice that your hands are shaking or your arms are shaking, and it's not something that you're doing intentionally. Parkinson's patients can also exhibit what's called rigidity of movement. So, for instance, if you take your arm and you move your elbow around and your forearm like this, normally it's just moving around like smooth, right? But in Parkinson's patients, that movement is not so smooth. It can actually be very, very, very slow, or just stop and go, stop and go. And then the other symptom that we see a lot in Parkinson's patients is what's called postural instability. So you just don't feel as steady on your feet. Now, while Parkinson's patients don't necessarily exhibit all of these symptoms, some of them are very what we call hallmark of the disease. So bradykinesia, that slowness of movements, that's something that really raises our red flags towards this diagnosis. And like I said earlier, even though there's not a particular test, a blood test or an imaging test that diagnoses Parkinson's, because it is a clinical diagnosis, it's important to do some testing to rule out other causes. For instance, if you have an abnormality in your thyroid function, that can cause some of these symptoms too. So you want to talk to your doctor in detail, tell them what you're experiencing, and then they'll guide you on more personalized recommendations so you can get the advice that you need. All right, let's get to our next question. And this is from Lisa. And Lisa has emailed us asking, I really want to be healthy, but I just can't find the time in the day. Can you share some tips of things I can do daily? Thanks for your email, Lisa. And I think a lot of us can relate to this. We all want to be healthy and live our best life, but it is hard to do with everything that's going on nowadays. It's hard to stay track on your health. But you know what? It's not that difficult. And I don't want you to think it's difficult either. I don't want anybody to put all this pressure on themselves that, oh, I'm not a healthy person and tomorrow I have to be a healthy person. This is something that should be done gradually because just like bad habits, good habits take time to build and for your brain to realize this is a new way that we need to be living. So start with small things. Maybe you're eating a bag of chips every day. Let's replace that with a bag of carrots and some healthy ranch. Do that for a couple weeks. Change nothing else. Just change that one thing so your brain becomes accustomed to it. And every few weeks, make the efforts to change things slowly. And, going for a 10-minute walk every day is still considered physical activity. You want to build up to at least 30 minutes, but even just doing that is something. So being healthy is the goal, but I don't want it to be such a scary goal or something that seems daunting and too difficult to do. Small changes can be just as impactful, and they also provide long-term sustainability of that healthy lifestyle. Since this is such a common question that I get, I actually have a list of top 10 things that I can suggest people do to stay healthy. So let's go through them. Number one, avoid or minimize intake of processed foods. We have come to learn, some of us have always known, that processed foods are very inflammatory to a lot of our body's mechanisms and can really set us up for disease. So we want to minimize the amount of processed foods that we're taking in. Now, when I say processed foods, there's a whole different variety of processed foods. Frozen vegetables are processed, but those are minimally processed. So those are generally okay. But when we say avoid processed foods, we're usually referring to those ultra processed foods. So like Doritos, sodas, cakes, cookies, really anything that Mother Earth didn't make. Let's get to number two. To stay healthy, you want to eat a predominantly whole foods, plant-based diet or as close to it as you can. Now, personally, I love steak. I could eat it every day, all the time, but it is so not healthy for you. So it's something that I minimize and I try to stick as close to a plant-based diet as possible. Number three is exercising regularly. You want to do both cardiovascular or aerobic exercise and strength training. And which one is going to be better really depends on your overall health, what your goals are, what your fitness goals are, what your abilities are. So you really want to talk to your doctor about it, but definitely moving your body every day is going to help. Number four is achieving 7 to 9 hours of restful sleep. So not just sleep where you're sleeping, but you're getting up, you're tossing, and you're not really getting the sleep that you need. You need to be waking up feeling restored, feeling refreshed, like, hey, I had a great night's sleep. And this needs to happen most nights, more nights than not, in order to have that restorative sleep and to optimize your health. Number five is minimizing mental and psychosocial stress, which is so hard to do nowadays. I know. We're getting bombarded by things all the time, whether it's personal life, work life, you name it. But it is important to take some time out for yourself to minimize all those external stressors and kind of just relax for a minute. Number six is avoiding risky substances. Alcohol, you want to minimize your intake of, illicit drugs, of course, smoking, nicotine, and marijuana, and excess caffeine. I know that some studies have shown that caffeine can be beneficial, but everything is to be taken with a grain of salt and personalized to you. So definitely avoiding excess caffeine is important. Number seven, this is one that may surprise a lot of you: cultivating meaningful and fulfilling social connections and relationships and building your community. Now, this is important because, well, it adds to your joy. And Happiness adds to healthiness and your longevity. And as I mentioned a little bit earlier, having those meaningful connections, studies have shown can actually alter and positively impact your DNA and prevent disease. So, more of a reason to go out and socialize. Number 8, this is very important but often underrated, getting annual preventative screenings with your primary care physician. Just as important as it is to treat disease, actually, it may be even more important to prevent disease. And getting those annual screenings is going to set you up for that by checking for disease early or monitoring that you're not at risk for something. It's always better to prevent disease than it is to treat it. And a lot of diseases are preventable. Number 9, limiting screen time. This is a lot of people's concern nowadays too, but it's very important to do. And last but certainly not least, staying hydrated. The saying is that your body is 70% water, so you definitely need to replenish it in order to have it working at its optimal best. All right, we just got another question in from Juan, and Juan sends this one in from Facebook. So let's see what he asks. I drink 3 cups of coffee a day. Some people say coffee is good for you, while others say it's dangerous. Is too much coffee dangerous, and am I overdoing my daily coffee intake? This is a wonderful question because, yes, sometimes we hear coffee is bad for you, and sometimes we hear it's great for you, and it's got all these health benefits. In fact, a study just came out that Harvard did that was specific to women, but it did show that a certain amount of caffeine intake on a daily basis reduces risk of disease in women. Now, I'd like to start by saying that too much of a good thing is also a bad thing. So whether it's caffeine or foods of certain types, anytime you overdo something, it's going to have its negative effects. Too much caffeine, too much coffee can put you at risk for a lot of health conditions, notably heart conditions. So we want to be careful when we're drinking caffeine. You want to make sure that you are not affecting and you're not negatively affecting any of your underlying health conditions. So for instance, if you're somebody who has high blood pressure or heart disease, you really want to minimize how much caffeine that you're taking in. So that being said, how much coffee is okay for a person to drink? And again, that depends on your personal health, but you want to keep it under 400 milligrams of caffeine daily. The other thing I want to say about coffee in particular is a lot of people, when they say that they drink coffee, they may have a little bit of coffee and a lot of milk or a lot of sugar or a lot of creamer. So you want to be careful of those hidden fats and hidden sugars as well. And again, you always want to talk to your doctor to get some personalized recommendations on how much coffee is really good for you. All right, now if you don't get your questions answered on today's episode, don't worry, because we have something wonderful called Ask Hanna, where you can send in your questions and qualified nurses are available to help. And here's some more information about that.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
All right, let's get back to those questions. We have one that came to us from Instagram from Alfredo. And Alfredo asks, since coming home from college, my sister seems to be drinking a lot more these days. She has a drink before dinner and then a few glasses of wine during dinner. She calls herself a social drinker, but I'm not so sure about that. Am I right to be concerned? Hi, Alfredo. Thank you for your question. And yes, you have every right to be concerned here. Now, when we talk about a healthy lifestyle, if you remember, one of the pillars of a healthy lifestyle is to reduce your intake of risky substances, and alcohol is probably at the top of that list. A lot of us underrate the importance of or the impact of alcohol and what it can do to our overall health. So we definitely do want to be cognizant of that, and we want to minimize how much alcohol we're drinking. A lot of people do view having a few glasses of wine with dinner as normal. I know in a lot of cultures that may be normal. And I also know that some studies have shown that red wine in certain amounts can be beneficial for different reasons. And while all that may be true, At the end of the day, alcohol is alcohol. It is something that's a foreign substance that does harm certain parts of your body, your liver notably. So you want to minimize how much you take in. Now, when you have instances where a loved one is drinking what you might think is more alcohol than they should be, it's a very touchy subject, and I encourage you to approach it very kindly and very gently. You never want to make someone feel bad about what they're doing because to them, they may think that it's not anything wrong that they're doing. The other thing you want to be cognizant of is when someone is taking in alcohol on a daily basis, especially if it's more than just a glass, there may be a mental health component there that needs to be addressed as well. So, like I mentioned, you want to approach this very, very gently. You want to have an open dialogue with your sister and let her know what your concerns are and ask her how she feels about it. Because that's the first step is asking how the person feels about it and if they see it as something that maybe is detrimental to their health and they may want help changing. Now, if your sister does want help changing, I think she's very lucky, first of all, to have somebody as supportive as you, but you want to make sure she gets the right help. So talk to her primary care physician about it and get her the resources that she may need. And then, of course, continue to be there to be the supportive brother that you are. I think that's wonderful. All right, let's get to our next question. And this comes to us from Ava. And Ava, reached out to us through YouTube and she's asking, one of the top 10 things to do one of your top 10 things to do, excuse me, is to limit screen time. I can't figure out how to do that and still get my work done and be able to keep up on social media. Help. Okay, honestly, Ava, I'm right there with you, and I know a lot of us are. Being a physician and owning my own business, I'm on my phone 24/7, well, maybe like 22/7. It's been difficult, and I know this is something that a lot of us are dealing with, but I have to consciously make an effort to limit my non-essential screen time. And one of the best ways that I have found to do that, I know a lot of tablets and mobile cell phones and even laptops have this feature. It's called Do Not Disturb, and it's wonderful. You put it on at a certain time at night, and for instance, for me, it's 8 p.m. So at 8 p.m., my phone and my devices go on do not disturb. So unless it's something very important or if it's an urgent phone call, it's not going to get through to me. It's not going to bother me until the morning. And that's probably the only way that I have found that I can let my phone go and not think about it, and really limit that screen time. Now, no matter what industry you're in, what your job or your school requirements are, it's important to have boundaries because screen time is not only detrimental, excessive screen time is not only detrimental to our mental status and our mental health, but also to our eyes, all that blue light straining all the time. In fact, I had my eye doctor visit with my doctor yesterday, and she asked me, how much screen time are you having? So it's important to really minimize if we're having too much screen time. And the other thing that I'd like to point out is that although social media is great for a lot of things, we don't need to always be on it. We don't need to know everything that's happening all the time. What we need to do is know what's happening with us, our loved ones, and what's important in our bubble of the world. Most of the time, I should say, take that with a grain of salt too. But I know especially the younger individuals nowadays are spending a lot of time on social media, and it can have some damaging effects. So you really want to be cognizant of that and limit the amount of time that you're on social media and screen time in general, even if it's for, something work related after hours. All right, let's get to our next question. And this comes to us from Rose. And Rose is worried about her husband. And she asks, my husband just turned 80, and even though he's always been fit and healthy, he doesn't want to walk with me or use the light weights the doctor gave him. I don't want to nag. What sort of things can I put on the honey-do list that might get him to exercise? Well, firstly, happy belated birthday to your husband. And there certainly are changes that may happen as we age that cause us to slow down a little bit and maybe not want to do the things that we used to do. To some degree, that may be normal. But if he suddenly stopped doing these things, you want to have that open dialogue with him and ask him, hey, honey, what happened? We used to do this, but you're no longer interested in it. Is it because it's painful to go out for a walk, or you just don't want to? Or, what are his thoughts around it? And it's important to figure out why he doesn't want to engage in these activities anymore, because then you can address that and maybe get him back into that flow. Now, you can think of maybe small projects around the house that you can do together. Sometimes that's fun. So maybe reorganizing a closet or a pantry together, which is always a fun experience in my my house, to be honest with you. But, start small. And then, if you notice that he's having fun doing those things, then maybe get him to gradually do bigger projects and doing them together, like cleaning out the garage or painting the patio, always keeping safety first. But it's important to talk with him and see what it is that he wants to do, because, as I mentioned, it may be something that he's not expressing to you. Maybe he is having pain doing certain movements. And if that's the case, then you certainly want to get him to his primary care physician so they can address that and get him back to an active lifestyle that he used to live. Again, I think it's great that you're there to support him, and definitely doing it together is going to probably be the best way to get him back to a healthy state. All right, folks. Unfortunately, that's all the time that we have. I want to thank you for your wonderful questions. I think not only were the questions great, but they were also very good at prompting some informative dialogue and conversation. If you have any further questions, keep sending them in, and we'll keep answering them here on Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.